Okay, my friends. You were talking about differences. Between the neurologic and the endocrine systems. All right. Talk to me. Give me a raised hand. I'm sorry, say again? Okay, so give me more details. Certainly the speed of the signals. Well, I suppose before we do differences, let's talk about similarities. Are you comfortable that both of these systems send messages, right, from the brain to the other parts of the body? But they do it in two very distinct ways. How does the neurologic system send its messages? Through nerves, right? The conduction, the depolarization, repolarization of these nerves. How does the endocrine system send its signals? Through hormones. So, hormones versus nerves, right? Endocrine system sending hormones. And truthfully, it's almost like a chain reaction, right? What's the main control center? Well, the brain, sure, but what part? The hypothalamus, right? Hypothalamus is that top control center, and it's going to send the signal to what? The pituitary gland, right? The pituitary gland, and it tells it usually to produce a hormone, then that hormone goes and hits another gland, right? Maybe it's the adrenal glands, maybe it's the thyroid. There's lots of different other ones that we talked about there. So it's this kind of chain reaction. Thymus to this, to the actual tissue, right? Whereas the nerve signal goes straight there, from the brain to that muscle, contract, and you're good. Okay? So hormones versus nerves, we can say direct versus indirect, right? You were starting to say something about speed. What were you saying about speed?
That word, it goes faster, like if you just went hot, you said it right away.
Okay. So which one is fast? The neurological system. Whereas the endocrine system is a slower, more over time piece. That doesn't mean it can't make things go fast. Adrenaline, right? That rush, that is a very fast acting hormone, right? So, okay, certainly the faster one would be the neurologic system, slower one being there. What else? Any other pieces? How do the hormones get around? Like they just have legs that they crawl to where they want to go? Like, in other words, what moves the hormones throughout the body? The what? The circulatory system, absolutely. The blood, that's one of the things that was, remember our pieces in the blood? One of them was hormones, absolutely. So again, that would be that indirect route. So if the pituitary gland secretes that hormone, it might have to go all the way through the whole entire system at time before it gets back to its target tissue. Right? Good. Are you comfortable that they're both very specific? So a neurological system is sending a message directly to this one area. Same with the endocrine system. Most of the hormones are very specifically targeted to one area, though I suppose there are some that have a more generalized usage. So we'll say specific versus more generalized. Though truthfully it's a little bit of both, endocrine system, right? Some hormones very specific. This is the follicle-stimulating hormone. It's going right to those ovaries, whereas other things are much more large. Estrogen, testosterone, big effects, lots of different organs, lots of different areas. Okay? Cool. Other questions?
Taking testosterone, like, same as taking, would you be like, if you played like a major league sport and you took testosterone,
Yeah.
would that be considered a steroid?
Sure. So this is a great question. I mean, you guys have seen commercials, right? Now, they're always talking about low T. Do you have low T? Maybe you don't even know you have low T. And they're saying this is testosterone. Your level of testosterone is lower. And so, I mean, the drug companies are pushing hard to make sure that you take this testosterone. Truthfully, as you get older, the level of testosterone decreases. That's the way it normally works. Is that a clinical condition that needs drugs? I'm not sure about. But your question about major league sports, absolutely. If I take testosterone, well, what benefits would that give me? Okay, you can add muscle quicker, certainly. Sorry? Aggression, so I can have, it does make me more aggressive. So, I mean, that would be definitely very beneficial to have a nice deep voice.
Very intimidating.
Good, yes.
Don't mess with me.
No, yeah, right. Yeah, but no, the big thing is mass, muscle building. That definitely would help with that. So yeah, that's why they all test for it. Yeah. It's a good question. Other questions?
Would that be the same for estrogen?
So she's asking the same question for estrogen, friends. It does the same kind of way. Estrogen decreases throughout life. Not necessarily like that, but over this period. Certainly at menopause, right? When your periods stop, that production of these hormones stops mostly, not completely, but significantly as well. So for a long time, over the course of the last 20, 25 years, they did what was called hormone replacement therapy, where truthfully these women would take pills to increase these levels of estrogen. What they found out was that it was having other significant side effects, some significant uterine cancers, some osteoporosis difficulties. There was a number of things that they've now said significantly they've decreased the amount of women who are doing this. It still on occasion is needed, but it used to be nearly all postmenopausal women were doing this, and now it's a much, much rarer thing.
Yeah, that was.
Okay. And it's definitely something that makes me wonder about the guys with testosterone. You know, again, we're going to have this big, huge ramp over the last 5 years of men doing hormone replacement therapy. Might it be the same kind of cycle, you know? I'm not saying some people don't need it. Some people do. But just so that I can perform better in bed, I don't know. Other questions, other thoughts? These are good. I like what you're thinking. Getting very, I like it.
Can you explain the difference between a neurotransmitter and the hormones and how they work in a sense?
Okay.
Something like
Good. All right, so we have a question in the front from Sarah. Shh. Stay with me, my friends. This is a little bit, I know it's a little loose here, so I'm just asking questions here, answering questions. The question was asked about the difference between hormones and neurotransmitters. So I'm curious. Hormones, neurotransmitters. What is a neurotransmitter? Do you remember this?
Is it like one of them not taser thingies, the one they shoot at animals? That kind of like
Tranquilizer.
tranquilizer.
Not the same.
But
the impulse conduction, absolutely. You remember that you've got this nerve, right? The end, and then here's another one here, right? And it comes, and the neurotransmitter is the things that move from one to the other. So,
Do they work like? Does it say
I mean, there are little receptors that are here that would accept these guys, and that would then cause a depolarization to continue down. Chemically, I'm sure there's differences between them, but you could almost say this is a very, 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 very localized hormone. I'm sure that they would differ with that thought, but the general process is very similar. I'm sending a signal from one side to the other using this chemical packet. I'm okay with that. I would not call a neurotransmitter a hormone, but yeah, similar usage. What's our main glands that we've talked about? Tell me the big ones he talked about. We go until, I gotta check 1 second, 30. Okay, so of course hypothalamus. What else? Pituitary. What else? Thyroid. What else? Parathyroid. You said adrenal? Where are the adrenal glands? They're right on top of the kidneys. Truthfully, literally sitting right on top of them. Okay, what else? The gonads. Gonads. And of course, that means ovaries and testicles. Gonads would be the general category you give for the two of them. And that was it, right? That was all the main ones he talked about. Oh, pancreas, sure, of course. Ooh, I think I don't spell that right. Did I miss anything? This is an A, is it? Yeah, terrible. Terrible spelling. Yes?
He wants to know like specific chemicals that each one makes.
The hormones you're saying? I do.
Like cortisol.
Sure. Yeah. I do. We're talking about the functions, and then we're talking about what they produce. Absolutely. Oh no, just the initials are fine. Initials are fine. Yes. So tell me about the hypothalamus. Tell me what it does. Tell me what its function is. Control center, definitely. What else? It sends signals to the pituitary. From where? From the nervous. Are you comfortable that this is like the bridge between the brain and the endocrine system? Is the hypothalamus. Okay? This is the bridge. The bridge between the nervous system and the endocrine system. And of course, it's reacting mostly and focusing most of its energy on that pituitary gland, because it's right next to it, right? The pituitary gland is almost attached to the hypothalamus. Mm-hmm. Sure, these are the hormones, right? This is ADH. Mm-hmm. What is, sorry?
ADH is the main regulator of
fluids. Sure. I do. I do. Yes, ma'am. Yeah. I do. Yes. What's oxytocin?
It's a little chemical.
It is. It does. Oxytocin is a drug that they give that's like that. That if a woman is not going into labor, this is one of the things they can give her to make her go into labor. Mm-hmm. Yeah, you got it. Pituitary gland, what's its function? The master gland. The master gland. And its main function is to do what then? Gets the signal from hypothalamus and sends them other places, right? How does it send signals other places? Oh, okay. All right, good. How does that pituitary gland send signals to other places? This would be an easy one-word answer. Hormones, right? It's taking and sending out, producing hormones to go get these other glands to function, right? That's why it's the master gland. So it has hormones that he talked about, and they're basically targeting these different glands. They say, hey, gonads, produce this. Right? The gonads produce what? Like, what are the main hormones they produce? Testosterone and estrogen, right? Yeah. So it's the pituitary gland says, hey, you guys, we need more. Come on, it's that time of the month. We need some of this. And it does it, right? Good. How about thyroid?
That's like weight and hunger, or no?
Sure. That is definitely the big one. When you have problems with your thyroids, you can go one of two ways. There are many people who become significantly overweight. It's a really strange thing. I don't know if you've seen some of these folks that are kind of really heavy on top, but super skinny on the bottom. And oftentimes that is someone who has had trouble with their thyroid. Because their metabolism gets messed up. Okay. How about parathyroid? Sorry? Calcium regulation? Beautiful. Right? Because where do we use calcium in our bodies? Our bones, sure, but what else? Muscles need it. Teeth, sure. Another big one, though. If you got that really spiky stuff, yeah, you may have some calcium. What about in your nervous system? Isn't calcium there, or am I off? I'm thinking potassium and sodium, aren't I? Terrible, Mr. Chemistry teacher. Terrible. I tell you, I'm tired this morning. So yes, muscles definitely, though. Good. What about adrenal glands? What's their function? Adrenaline. That's what they produce. But what's the function? Like, what's the point of adrenaline? Are you guys with me back there? I'm tossing at you. All right. Talk about function of adrenal glands. Yes, it produces adrenaline. I'm cool with that. Does it say anything? What's that? Sure, you have the cortex and the medullary. Those are the two parts of it, right? Steroids and... Oh, that lovely long word that you can pronounce. Catecholamines. Okay. It has a piece to do with that, absolutely. That's more your sympathetic nervous system, but yeah. He didn't give any more details on that, is that correct?
They said stress increases blood sugar in times of stress.
Okay.
That's cortisol.
Sure. I just wanted to make sure I'm not asking something that wasn't there. Look at it above the kidneys. You have the two pieces, cortex and medullary. I'm not going to ask you. This is a nice one to know. Add renal. Renal part is the kidneys. So that would be an obvious something. Yes. Where's the thyroid and parathyroid? Right here, right above that Adam's apple, like right there. As you swallow, that's really what you're feeling. Is that thyroid gland? Of course, you know where the gonads are. How about pituitary? You all should know very well where pituitary gland is. Don't you remember that little saddle in the skull? The sella turcica, right? That is where the pituitary gland sits. That's why it has its own little case. Yeah. Very good. Again, not asking you to know anything that's not. Hang with me, please. Please. Just let me finish. Not asking you to know anything that's not on the video, other than our differences. But you should be able to enunciate the differences between the neurologic and endocrine system. Okay? Adios.